doctor. Hi, ToothHQ. My upper corner tooth has decayed and rotted. When I visited the dentist and had an x-ray, they told me it's a baby tooth and that my permanent tooth is still present inside the bone. They advised getting braces. I'm 45 years old. Is it still possible for the permanent tooth to emerge at this age, or are braces effective at my age?
Great question. I'm so glad like you're 45 years old, you're still a baby, right?
Mhm.
All right, that's what like we make fun of patients. Oh, you're still a baby, right? So you're 45, and then you have a baby tooth, and the tooth is completely decayed and rotted. Not a problem at all, and you definitely need to get that tooth taken out because the tooth is rotted. You can't really do anything about it, right? And then you still have the permanent tooth which is present inside, right? And so when you have a tooth present inside, um, you got multiple options now. uh, if you have the right space, you can use braces to bring the tooth in place. Sometimes, when patients get older, they say that, oh, I don't have the patience to go through braces, and are there any other options, right? So then we can remove the baby tooth at the same time. We can remove the permanent tooth also. Then we can give you the option to replace the tooth with the dental implant. So your options are, the number one, the baby tooth needs to come out. There is no question on that because it's completely rotted, and you don't want to be in pain when it starts to get infected. So get it out. Once you get it out, now you got the permanent tooth that is completely under the gum. So the two options you have are either to get braces to bring the tooth into position, or the next option is to remove the tooth completely to get a tooth replacement using dental implant. Oh, one more thing I forgot to say here is, on the option number one, when you decide that you want to get the tooth brought into place using braces, at the same time, let's say you happen to be in our office to remove the tooth, then we do exposure and bond.
Yep.
You know what that means, right?
I do know what that is.
Go ahead, say what it is.
So exposure and bond is when they expose the tooth and then they use like a chain-like instrument or device,
Yeah.
right, to help bring the tooth down, to
Okay.
encourage it to drop, right?
You got it.
Okay.
You got it. So what Shai is saying is, at the same time we remove the tooth and we attach this small device to the tooth which is completely under. So we expose it and then we bond this little chain, and then we bring it and then we put it outside and then tie part of the braces, and then your orthodontist is going to use the tooth to use the device to bring the tooth into position. Now magically the tooth which was under the gum line is just going to reappear.
Perfect. Absolutely. It's a magic trick. It's like Houdini.
Yeah, you got it.
Yeah, you can name your tooth
Did-
Houdini.
You want to tell the callers, and a lot of people may not know
Who Houdini is?
Yeah, Houdini the magician.
Yes, he used to get himself out of boxes. I don't know too much.
Yeah.
Absolutely.
Yeah.
Perfect. So,